August is Psoriasis Awareness Month. The disease is an inflammatory immune-mediated disease that causes excess inflammation impacting the skin, joints, and other organs. So we have Dr. Matthew Harrison here, the expert on this, to tell us more about it. Let's start with this diagnosis. What are some of the signs and symptoms someone might notice?
Well, the classic symptom that you're going to notice is that a rash with a scale. It's usually on the extensor surfaces of the elbows or knees, and it usually has this white scale over it. It's very itchy and usually happens over a long period of time. Typically, patients that we'll see with psoriasis are in between the age of 15 and 30, but it can actually happen at any age.
Okay, and so that elbow, kind of the first thing that might tip you off that
Typically,
something's wrong.
There's a lot of actual versions of psoriasis. So there's 5 different versions. You have plaque psoriasis, which is the usual one that we see, and that's kind of what you're talking about there, with that rash that's kind of pink and red, and then has that scale over it that builds up over time.
And how do you diagnose it if someone comes to you with something like this?
It really is clinical. So when I take a look at it, I'm going to see that rash. It's usually well demarcated, like I said, with that reddish, pinkish tinge and that scale over it. And then a lot of times they'll just be saying, hey, I've had this forever. I've used some hydrocortisone over the counter, and it still persists. What is this? And then that's usually how I diagnose it.
When someone does get this diagnosis, what are the treatment options? Is there anything that can be done?
Yeah, so it actually depends on the severity of disease. So like I said, there can be really mild. You can just have it on your elbows or on your knees, but sometimes it can be really more widespread. And so typically, I prescribe a topical steroid for this. It works pretty well for mild disease, but if it's more severe disease or moderate disease where it covers more of the body, or you have psoriatic arthritis, which can also happen with this disease, sometimes with that, we'll have to use something called a biologic, like Humira, which works to decrease the immune system and actually helps for that too.
Good to know that there is treatment options. Whenever we talk about something like this, I feel like it's better to end it there on a happier note that if you do get the diagnosis, there could be some help out there.
Definitely.
Okay, well, thank you so much for coming in and telling us all about psoriasis.
Thanks
We
for having me.
appreciate it.